And now we go and even broader. And if you ever wondered whether we have big data science and environmental health, you probably are now convinced that we do. But Dr. Marlier will actually take us international. She has worked nationally and internationally on wildfires in Indonesia, agricultural waste burning in India, and is also now modeling all of this for us here at UCLA. So welcome, Dr. Marlier.
Okay, great. Well, thank you for inviting me here today to join this panel. I'm excited to share some of the work that I've been doing looking at wildfires. So what I'm going to do in my 7 minutes is start with a little bit of background on the connection between climate change and wildfires, then talk about why this matters from a public health perspective. And then finally, while this is truly a global problem, I want to share some work that we're doing at FSPH that is focused on wildfires here in California. So since this is a panel on climate change, I do want to take a moment and explore that link between climate change and how that is driving changes in wildfire activity. So changes in climate in the Western US are creating warmer and drier conditions. And so this is helping fuel beds to dry out and make wildfires more likely. What you're seeing on this figure on the slide is wildfire burned areas since the mid-1980s in the Western US over time. And this has been split into the contribution that is due to climate change, and that's shown in orange. And there are a couple of key takeaways here. First, without including that contribution of climate change to wildfire activity, models cannot replicate the observed burned area and those increases that we've seen, particularly in the Western US. And also, this has corresponded to a doubling of forest fire area in the Western US. So what are the consequences of this increase in wildfire activity? Well, looking at this series of images that has been collected from a geostationary satellite is probably somewhat familiar to many of us in the room. We've experienced it firsthand in California with several recent severe fire seasons in the past couple of years alone that have broke many records in terms of burned area and lives lost. And what we're seeing here in Washington, Oregon, and California, this was during the 2020 severe fire season. We're seeing actively burning fires in the red and orange shades. But I also want to draw your attention to the large amounts of smoke production that is blowing smoke across the West Coast and also beyond. And my research here at FSPH focuses on this contribution of wildfires to smoke production and what this means for an outdoor air pollution burden. I focus a lot of my work on fine particulate matter, or PM 2.5, but wildfires also contribute to other sources of pollution. So recent work has found that in high fire seasons, smoke in the Western US can make up almost half of the outdoor air pollution burden. And this is a growing health threat, and this is suspected to increase with future climate change. So our research here at FSPH is looking at wildfire smoke across a number of different dimensions. First, we look at how can we estimate this exposure? Second, how do we think about who is the most vulnerable? And third, what can we do to reduce the public health burden? So I'm going to share a couple of recent and ongoing projects that are looking at each of these questions in turn. So the first question is, how do we estimate smoke exposure? And my research specifically looks at how can we tease apart that wildfire contribution to air pollution. And to do this, I use a combination of satellite remote sensing data as well as atmospheric modeling approaches in order to estimate the wildfire-specific contribution to outdoor air pollution. And this allows us to do a couple of unique things. First, we can separate out wildfire smoke from other sources of pollution. Second, we can incorporate this information into climate modeling frameworks to try to understand what future scenarios of climate change may bring. And third, we can look at overlapping climate-related exposures. And that's what you're seeing here on this slide. And it follows really nicely from David's talk, but thinking about how populations might be exposed to extreme heat and wildfire smoke at the same time, and what those consequences might be for health. The next question that we're looking at is who might be more vulnerable to wildfire smoke exposure. So this plot is showing results from a study that we recently wrapped up that was looking at the vulnerability of agricultural workers in the state to wildfire smoke pollution. And this is a group who might be more vulnerable due to several factors, including the outdoor and physically demanding nature of their work. So what we did in this study is we ran climate modeling simulations of past and projected future wildfire smoke, and then we analyzed the difference in the context of our primary agricultural producing regions in the state. And what we found, focusing on that first row, is first, the future smoke pollution burden is expected to be the highest in Northern California, as well as parts of Central California. But in terms of vulnerability, agricultural workers who are located in the central part of the state are highly vulnerable to these increases. And the last question that we're looking at addressing is, what can we do to reduce the public health burden? And what we're doing here at FSPH is developing online decision support tools that can quantify the benefits of different land management strategies, such as prescribed burning, that might reduce wildfire severity in the future, and quantify what that would mean from a public health perspective. This is showing a screenshot from an online decision support tool that is currently in progress, where users will be able to evaluate changes in different future policy scenarios and rapidly quantify what the public health benefits would be. So to wrap up, I'd like to talk just a little bit about where we're going from here. So first, as I mentioned, we're interested in exploring the joint health effects of overlapping climate-related hazards. I gave the example of extreme heat and wildfire smoke, and there's potential there, along with other climate-related hazards, to exacerbate certain health conditions. Second, we're building on our vulnerability work to try to understand who across the state is the most vulnerable to wildfire smoke exposure and what people can do in order to protect their health. And finally, we're working to continue evaluating policies to reduce wildfire incidents and smoke exposure. And this ranges from local to regional policies, such as land management, to more global climate mitigation policies. So thank you for inviting me here today, and I look forward to our discussion.